Okay, so this is the head, face, nose, mouth, oropharynx, and neck exam. So to start, we're just going to be looking at our patient here. We're going to be looking at how their head sits on their neck for their posture, see if there's any deviation to any side. Right now we could also be looking at the eyebrows, seeing where they start and end, if there's any differences on either side, and same with their eyes. You could be looking at their lips and their nose as well. We could look from the side. And then we come behind the patient to assess their hair, be looking at the hairline, and then we could be feeling for any lumps or bumps in their head. Is there any tenderness with any of this?
No.
Okay. And if they were a elementary age kid, we'd also be looking for lice. And then when we're also back here, could do the parotid glands. So I'm going to palpate those. Let me know if there's any tenderness.
Nope.
No? Alright. Coming back in front, we're going to do the cranial nerve 5 test. We're going to start with sensory. So I'm just going to be touching along the top of your forehead, down your cheeks, and then along your jaws, alright?
Okay.
Alright, close your eyes, let me know if they feel the same or different.
Same. Same. Same.
Same, perfect. And next we're going to do the corneal reflex for cranial nerve 5. So I'm going to have you look off to the side. I'm just going to touch this with the end of it and see if it makes you blink. Alright. And then have you look that way. Perfect. Alright. And then we will so this is going to be for cranial nerve 5 for your muscles of mastication.
Okay.
I'm just going to place this in your mouth and have you bite down lightly, and I'm going to tug. So have you open your mouth. Okay, bite down lightly. Alright, and we'll do the other side. There we go. Perfect. Alright, and then when we're up front too with the face, we're going to feel the sinuses, the frontal maxillary, and then percuss them. So let me know if there's any pain or tenderness here.
Nope.
And we're going to go here.
Nope.
Okay, and we're going to do some percussion. Any pain?
Nope. Nope, no pain with any of it.
Alright, perfect. And then we're going to auscultate the orbital artery and the temporal artery, listening for bruits, using the bell of the stethoscope. So something here. Alright, and then I'm just going to place this over your eye. So I can have you look up slightly, and then close your eye and you're just going to feel some light pressure. Alright, that was normal. So then we're going to move to the nose. So at first I'm just going to look at the patient's nose and see if there's any deviation on one side or the other. And then we're going to look inside of the patient's nose, so can I have you look up slightly?
Okay.
I'm going to use my otoscope, and we're just going to come up here. We're going to look inside, looking for pinkness, any sort of bleeding, lesions. It's good. Alright, and then moving to the mouth again. So I'm just going to ask my patient to open his mouth. I'm going to be looking at his cheeks and his gums, using my pen here. Looking to see if there's any sort of lesions in his mouth and his cheeks, looking at the gums on the top and the bottom. And the gums up front here. And then we depress his tongue, look at the soft palate, the hard palate, the uvula, and his tonsils. Can I have you stay Looks good. And then I would also grab, I don't have it with me, but I grab a paper towel to grab his tongue, and I look at the sides of his tongue, top and underneath, to look at the frenulum. And then can I have you stick your tongue out at me? Alright, that's cranial nerve 12. You can put your tongue back in. Can I have you smile? Frown. Puff your cheeks. And can I have you raise your eyebrows? And that's for cranial nerve 7. And then finally for cranial nerve 9 and 10 are going to do the gag reflex. So I'm going to be pushing this in your mouth. I'm just going to be looking for the uvula to rise equally on both sides. Is that right?
Okay.
Do you have a bad gag reflex?
I don't know. Nothing
Okay.
usually touches there.
Okay. Just gonna open up. Okay. So then we'll be using tangential lighting to look at the neck, hold the light out to the side, and we'll be looking for shadows, which would indicate a mass of some sort. Do that on both sides here. And then we would be looking at the trachea to see if it's midline, and then ask the patient to swallow. Alright, and that would just be looking to see if the trachea elevates and stays midline. And then we will do the tongue test. So go here, and then on his Adam's apple, and ask the patient to swallow. And that pulls my finger up. And then while we're down here, we can also find his thyroid. So we go to the Adam's apple, down to the cricoid cartilage, and be feeling around there for any sort of abnormal masses. Shit feels good. And then we will come behind the patient. And then for cranial nerve 11, can I have you turn your head to the left?
Sure.
And then we're going to push, resist my pressure. Be looking for the right sternocleidomastoid to contract. Then have you turn your head to the right. Resist my pressure. Looking for the left sternocleidomastoid muscle to contract. And then can I have you shrug your shoulders?
Okay.
And then don't let me push down.
Okay.
Nope, keep them up. Nice. Alright. And then we will finish up with the lymph nodes. So start with the preauriculars. We go to the postauriculars. We go to the tonsillar, submandibular, submental. Come around to the occipital and the superficial cervical, the deep cervical, or the posterior cervical, and then underneath the SCM, which is hard to feel, is the deep cervical chain. So that would wrap up that exam.